All right, hi everyone. This is our third mini lecture for the reproductive system, and we're basically wrapping up our discussion of male and female development from an embryonic sense. And what you should do at the end of this lecture is go back and review your terminology from the first lecture and make sure you understand all of those different terms and sort of what things might fit under those. So I'm going to keep this lecture pretty short. All we're going to talk about is descent of the gonads into the pelvic cavity. All right, so remember that when we started our discussion of development of gonads in an embryonic sense, that I noted that the kidneys were actually lower in the pelvic cavity or the abdominal cavity, and that the gonads were really high in the abdominal cavity. This is not where they ultimately end up. So the ovaries are going to descend into the pelvic cavity, and the testes are going to descend actually external to the pelvic cavity and out into that scrotal tissue. So we do need to get a lot of movement of these gonads from their location during embryonic development into their sort of the area that they occupy in an older individual. So we have a couple of terms and structures that we need to know to understand what's happening here. So we're going to start by comparing a 3-month fetus to an 8-month fetus and look at the progression of the pieces as we start moving towards that end point. This is a male, so we have the penis structure that's developing here. This is the scrotal swelling, so it's going to become the scrotum. Up higher in the body, we're going to have the testes, the related ducts here. This is the pubic symphysis, so we can see that we're actually sort of in front of that bone. This is going to be the end of the rectus abdominis, so our rectal muscles, or abdominal muscles. And what else do I need to point out? Okay, yeah, so the gubernaculum is our first term. The gubernaculum is going to be basically a thick cord of connective tissue that is attached from the testis to the floor of the pelvic cavity, which is the scrotal swelling. So we can follow this cord. It's attached to the testis and is anchored into the scrotal swelling. We can see at 8 months that we still have a similar arrangement of tissues, right? We still have our ducts, we still have our testes, our scrotal swelling is enlarging, so it's looking more like a scrotum at this point, and we can see this gubernaculum, which is still shown here in green, is shortening up. So it's basically pulling these testes down into the scrotal sac and giving us more of that developed sort of appearance. Our next term is the vaginal process. So we do have a fold of peritoneum, and if you don't remember what the peritoneum, now is a great time to go back and review that. I will take this instance to remind you that you do have a cumulative final coming up, and you may want to start sort of dabbling in review for that. So peritoneum is a good place to start because we talked about that in the digestive system. But we have this membrane or this peritoneum which lines this cavity, and as we pull the testis down, we end up pulling some of this down into the scrotum with it. And so we can see that here where we have this vaginal process, this membrane is getting pulled all the way down into the scrotal swelling at this point. And the last piece that we want to look at is the inguinal canal. And so that's the pathway that is actually created by this process. And so we have this opening from the abdominal cavity basically down into the scrotum. This is where we're likely to see hernias. So hernias are pretty common in males, and that's because this is sort of a weak point. And so sometimes we get bulging of structures out of that area before this sort of gets tightened up. So now let's look at this in a newborn, right? So this is a 1-month-old. We can see that anatomically it looks like we would expect it to look now. So we have full development of the penis. We see that the scrotum is now enlarged and actually contains the testes. Some males are born with the testes still in the upper pelvic cavity, so they haven't actually descended all the way down into the testis yet. Some will naturally descend the rest of the way shortly after birth. Sometimes they have to go in and surgically bring them down into the scrotum. Usually it's not a huge deal if the testes aren't in the scrotum at this point or they're undescended. It can cause complications later in life. So during reproductive years, if the testis is up high in the abdominal cavity or has not descended into the testis, that person would likely experience infertility. It's called cryptorchidism. or actually increased incidences of things like testicular cancer, or other sort of diseases that are associated with the testes. So we do want to make sure that they get brought down into the scrotum if at all possible. So another thing that we see is this vaginal process has been closed off. So the inguinal canal has come together and we have just this sort of remnant here. This sort of open space is called the tunica vaginalis. We do still have the gubernaculum. So the gubernaculum is very short at this point, but it's still anchoring or holding this testis in place. We don't want that structure to be lost, because then this testis would be mostly sort of free floating in this sac of tissue. We don't want testicular torsion or wrapping or anything to get pinched off, and so this gubernaculum helps keep this testis in this orientation. And we do have the spermatic cord, which is all these tissues that run through the inguinal canal. It's going to be the ductus deferens. It's going to include testicular arteries and veins. Piniform plexus is going to run through here, but all of that is wrapped nice and tight and kept together through that inguinal canal. And so we do see a similar process occurring in the ovaries. The ovaries don't need to descend nearly to the extent that the testes do. We do still have a gubernaculum, so here's at 2 months of fetal development, and here's, I believe this is 15 weeks post-birth, so a few weeks post-birth. What we end up seeing is the kidneys, right? So we can see them here and then we can see them here. They've sort of flip-flop positions where the kidneys are higher and the tissues that become the ovaries are dropped down. We do have a gubernaculum here. So it's this structure shown in blue attached to our ovaries. It's going to help us pull down and resituate the ovaries deeper in the pelvic cavity. And they actually become, the gubernaculum is again attached to the gonads, but also anchored in the homologous tissue in a female. So it's anchored in the labia majora here. And once the gubernaculum has pulled these ovaries down into their location, they are going to become a pair of ligaments that help support the ovaries and the uterus and keep them in the right locations in the pelvic cavity. All right, so that's all I'm going to cover in this little mini lecture. I think since the first one was sufficiently long, this is enough material for today. Again, I would ask you to sort of review those terms and make sure you know a gonad and a gamete and a primary sex organ and a secondary sex organ and a secondary sexual characteristic and all of those things that we've discussed in these last couple of lectures. So in our next set of mini lectures, we will go through male reproductive anatomy, and then we'll talk about the physiology of the male reproductive system. And then next week we'll move into females, and then we are essentially done. So I am, yeah, it's moving fast. So I will talk to you again soon.